Hello friends and welcome to the channel. My name is Dr. Mohsen Raj. I'm a DM cardiology student at AIIMS New Delhi. This video is a different video than the rest of the videos on this channel. Well, usually I encourage you, the students, to work hard and aim high and get the top ranks, join the best college of this country, right? But this video, I want to warn you. I want to tell you about, and of course, you'll be aware about things what are going on around you. With the recent news of Dr. Archana Sharma, she was a gynecologist, and one of her patients died due to a known postpartum complication, postpartum hemorrhage. They say if you haven't watched a postpartum hemorrhage, you haven't even watched a hemorrhage. I mean, that's one of the most torrential bleedings. Patients can die within minutes. Okay? So, unfortunately, one of our patients had this complication after delivery and she succumbed. But the situation in this country, the situation in the society is that if a patient dies, even due to natural conditions, the doctor gets blamed, and that's probably the reason for her death, the reason for her suicide, because the media around her or the society around her probably blamed her for the death of the patient, right? But in general, I work in an Apex Institute. I'm away from such things. People visit AIIMS at the end of their illnesses, and with great respect and with great expectations from this institute. But you know what? Many times when I interact with patients, you know what they say? That the doctor that we consulted outside gave us unnecessary, useless, costly medications, costly treatments, unnecessary procedures that were done on them. And when I reviewed their records, I find that all the tests, all the medications, all the treatments, all the interventions done by that respected doctor are appropriate. But the patient doesn't understand that. It's because the image of a doctor in the society is become, pretty low, right? So that's one part of the story. Even these stories are pretty common. Every now and then you see resident doctors being attacked. You know who these resident doctors are? These are students who had been brilliant throughout their school. These are students like you who qualify NEET, who complete their MBBS, who complete their internship. Then they completed their journey in NEET PG or INICT, joined a big institute. They're brilliant students working for the patients, and then all of a sudden, some goons, some attendants actually harass a doctor or physically injure a doctor. So that is the state of this country, and these instances are not exceptional. These instances have become a routine in our country, right? So that's one part of it. You would be under a constant threat of physical violence at any moment in your career, right? And this is not even young junior doctors working in emergency, even senior doctors have been assaulted in our country, right? So that's one part that you all should be aware of, and you all should be at least mentally prepared for. One. Second, the conditions in which the junior doctors work in our country, they're pretty harsh. If you go to a peripheral hospital, if you go to any state medical college, if you go to any of their wards or emergency or OPDs, who is seeing the patients, who is attending the patients? Junior resident doctors, senior resident doctors. The resident doctors, basically, they form the backbone of the hospitals of this country, right? So, you know how many patients they get to see in an average OPD? A single doctor, say, sits in an OPD from 10 a.m. and sees the patient till maybe 2 p.m. or 3 p.m. And he gets to see 150 to 200 patients, which gives him 2 minutes or 3 minutes, or at the max 5 minutes per patient. Now, I can't even imagine a junior doctor making a diagnosis, prescribing the appropriate treatment in 2 minutes' time, because that's the state of the hospitals. That's the state of the government hospitals. So much of rush. So that puts stress and strain on young residents. They have to be very fast, and which which burdens them physically, mentally, and they tend to make mistakes, which is expected with such a workload. Same is true in the wards. They get to see not 10 patients, they get to see 100 patients in a ward, sometimes 3 patients on a bed, and they're expected to work at their best because a doctor is always expected to work at their best, right? So that second amount of stress. And if you visit an emergency of any government hospital in this country, you would literally go mad by the amount of work that resident doctors do, right? I mean, this is not some fact. This is a truth. You can go and visit any hospital, any government state medical college near you. Just go and visit. You'll find how hard the resident doctors are working there, right? And let me tell you, they work for more than 80 hours a week. That's not a joke. Tell me which other profession works for 100 hours a week. Where would you see a person in his 20s working for 36 hours non-stop, and you know how much they're paid for? How much they're paid for that work? There's a huge disparity between the different states. States like Delhi or places like Central Institutes would offer you good salaries like 90,000 or 1 lakh for a junior resident, mostly 80 90,000 for a junior resident. But there are other places, other states which give salaries as low as 40,000. Imagine you working 80 hours a week or maybe even more and being paid 40,000 a month. I mean, you're sacrificing your prime youth, you're sacrificing your family, your fun, your other hobbies. You're working for the hospital, you're working for the patients, and at the end of the day, you're given such a small salary, such a small stipend. And at the same time, another doctor working similar to a similar extent, similar hard working in a different city, in a different hospital, is given double the amount of salary, right? There's so many disparities in salaries in it. I can make it a separate video on that, how my friend in Rajasthan earns just 40,000, while I earn here in Delhi maybe 1 lakh. So that's a disparity when both of us work, to the same extent. So one is the threat of physical violence. It's true. You have to face it. Second is the workload that's enormous in India. And third is the disparity in pays. You get paid well in some cities, you don't get paid well in other cities. Fourth interesting phenomena that happens here in India is the bond system. If you do a junior residency, if you do an MD or an MS from a particular state, or a super specialty DM or MCH from a particular state, you have to serve a bond period within that state. And some states have bond periods of 3 years. Imagine you go to that place, you work in that place as part of your medical education, as part of your post-graduation, then you're supposed to work there in their rural settings for 3 years. I mean, I don't know what the purpose of this bond system is, but this is another truth that you have to face here in India after you've chosen to become a doctor in this place. Number last is the quality of education, the quality of research that you will get to feel in a peripheral medical college. Leave aside the central institute like AIIMS, PGI, where yes, they do give dedicated time to research and all. They do have dedicated time for academics, but by and large, most of the peripheral state medical colleges don't have dedicated time for education, for studies, and for a dedicated teaching schedule for postgraduate students or super specialty students. And not just routine education, even for research, they don't have dedicated research programs or research mentorship in those places. So overall, the final conclusion that I tell you is that in addition to the huge workload which puts on physical and mental stress, which keeps you away from your family, there will be no weekends in your residency, by the way. You'll be in the hospital on Saturdays, on Sundays, on Diwalis, and Holis, on Eids, and all the days, right? In addition to that, the huge pay disparities and the fact that your education quality, the research quality is not up to the mark, well, what's the purpose of doing your residency in India? That's just one aspect. Okay, of course, I'm happy I did it here. I'm happy I worked hard. I'm happy that I happened to be in AIIMS and I happen to be in the best institute of this country, uh, with the best education facilities, with the best research facilities, and with the best patient services. But I had to present this part of the story as well to you if you are an aspirant, if you want to become a doctor. So be aware of these facts. Thank you.